Hi, Dr. Garima here again, and we are discussing another of March 2025 question on community dentistry. I have less time, so I'm just quickly going to jump to the question. For all the new candidates, watch my other video to understand more about it. Let's just directly start with the question. The teacher invites you, the dentist, for oral health promotion for children aged 5 to 8 years. One child comes to you and shows you his tooth having pain. What will you do about it? So, see, they have mentioned that age because that age is very important. In this age group, like the child himself cannot give consent for any treatment. But you, as a dentist, have anyways gone to promote health awareness. So, if a child is just coming to you and shows you his tooth having pain, what exactly are you gonna do? You cannot ignore the child because he's come to you as a doctor. But at the same time, seeing the age of the child, you can pretty much not do anything in his mouth which is invasive. But can you have a look? Yes, you can have a look. Let's see what all you can do and what all you cannot do, and what do you need to do to relieve the child of the pain. Okay. So, if a child aged 5 to 8 approaches me, that's as a dentist, during an oral health promotion session and shows me a painful tooth, I will first acknowledge the child's concern. Okay. I would respond kindly and reassure the child that I understand they are in pain and that it's important. I will respect the scope of my visit. What is the scope of my visit? Is to spread awareness. Provide a written note or referral suggestion advising the child be seen by a dentist promptly. So I can do that. I will follow all the ethical and legal boundaries. So I will be in the open public space if a child is coming in the presence of a teacher. If the child feels safe and it is safe to do so, I can ask the child just to open the mouth and show me the tooth. But I cannot provide a diagnosis because I have not done a clinical examination. I cannot do a clinical examination without the consent of the parent, because any clinical examination, meaning me putting my mouth mirror in the mouth, which though is not an invasive procedure, but it is still going inside the child's body, and that you cannot do because the child is small and is not having the consent. Now, no treatment or formal diagnosis will be given without parental consent, appropriate setting, or documentation. Maintaining confidentiality and ensure the child feels supported and not embarrassed. Do you understand? It's a little complicated situation here because you're a dentist and you can see and you can say, oh, this is the cavity and this is that and those. But no, you cannot write that because it's not an appropriate setting. You can look, you can reassure the child, you can ask him to come with the parent, but yes, you can just ask him to open his mouth in presence of a teacher and have a look. That's it. No touching, no taking the mouth mirror and doing a clinical examination. Now, since I'm present in the school for oral health education, not for clinical diagnosis or treatment, I will not perform a full clinical exam on site. Basic visual observation, if appropriate. That word is very important. If it's appropriate in that setting. If permitted and safe and with the child's comfort in mind, I may do a basic visual check without any instruments just to see if there is an obvious sign of concern. Example, visible decay, swelling, or an abscess. Like, is there something immediately that need to be concerned about? So you have to take an emergency step, or you can just see, okay, it's something which is not requiring an emergency treatment or an urgent need for attention, but can be, given a referral note and can be asked to come to the clinic to get it treated. Now, refer to parent or the guardian, and I would inform the teacher or the school staff that this particular child is having a tooth issue and that his parents or the guardian have to be informed about it. Correct? Now, why this approach is correct? Because it maintains professional boundaries. It prioritizes the child's welfare, the first reason that you've gone to do that. Adheres to legal and ethical standards, especially around consent. Keeps focus on health promotion while still being responsive. Understood? So this is as simple as it can get. From where did I get all this information? Policy Statement 2.3.8, Infants and Preschool Children from ADA, that's Australian Dental Council. I've just opened it out here for you all to have a look. So this basically gives a general guideline, not exactly it's going to give you the question, but it pretty much states what you can do and other guidelines that I'm referring to. Now, I would recommend all of you all to just go through this website. They have various guidelines here, and I'm pretty sure the questions are formulated on a lot of these guidelines. They have given a general information and then they make a question and they'll give you the options from these guidelines so they can twist and turn the words here and bit. But if you know the concept, you can answer. So I hope this was pretty much clear. You can again watch this video to understand and remember and revise more. I hope this was helpful. And again, if you have more community dental questions with regards to Australia, all those candidates who have given part 1 exam and you would like me to make a video on it, just message me the question and I'll do that. Thank you. Bye bye.